Well, hello, this is Dr. Philip May. I'm going to be talking to you about the practice of neurodisabilities medicine and the 5 essential concepts needed for the optimal practice of neurodisabilities medicine. So let's get started. Before we get started, I just want to mention that the major functions of the brain include memory and learning, control of motor function, control and routing of sensory input, and emotional regulation and control. And these functions require that specific interrelated brain structures work together in a coordinated fashion. When these relationships are improperly developed or disrupted, brain dysfunction will occur. What do I mean by neurodisabilities medicine? Neurodisabilities medicine is the medical evaluation and treatment of adults with chronic brain dysfunction, or CBD. There are 3 categories of chronic brain dysfunction. There's the childhood onset type, for example, developmental disabilities. There's the young adult onset type, for example, traumatic brain injuries or various types of accidents that can injure the brain, which are more commonly occurring in young adults. And then there's the aging-related onset, for example, Alzheimer's disease and strokes. Now, who are the patients we're talking about that have chronic brain dysfunction? The adult patients with chronic brain dysfunction, CBD, may carry the following diagnostic labels. They could be known as people with developmental disability. This refers to people with intellectual disability, epilepsy, cerebral palsy, or autism, which are common developmental disability labels or categories. Secondly, there may be traumatic brain injury, or TBI. A third example is Alzheimer's disease. A fourth, stroke. 5, hypoxic brain injury from many different causes. And lastly, toxic brain injury. There are many toxins that can damage the brain. There are other examples, but these cover many of the different types of diagnostic labels that you'll encounter in the person who has chronic brain dysfunction. How many people are we talking about? The exact numbers are hard to come by, but a close estimate may be approximately 15 million. There are roughly 1 million of these individuals who are severely disabled, who have severe chronic brain disorders. And the cost to state and federal governments is over $30 billion a year. Why are we having this talk? Most physicians who provide primary care for adults have had relatively little training or experience with this population of adult patient. These patients may be found in state developmental centers. They may be found in rehab facilities, nursing homes, veterans hospitals. There are many different chronic care facilities where people who have chronic disabilities secondary to a chronic brain disorder may be living. Now, there are certain concepts that are needed by the physician in order for that physician to be able to practice optimally the practice of neurodisabilities medicine. And these concepts are, and I'm going to be going through these with the rest of the talk, but the first one is chronic brain dysfunction, or CBD. The second is specific brain syndrome, SBS. The third refers to the complications of the specific brain syndrome. 4, the consequences. These are the health conditions that result from the complications. And then the last is syndrome-specific complications. And I'm going to go over these 5 concepts which we call the 5 essential concepts, with the next slides. Okay, starting with chronic brain dysfunction. This is the first essential concept. Chronic brain dysfunction, or CBD, is defined as a state of continuous and evolving signs and symptoms that result directly or indirectly from a specific type of brain injury. The second essential concept is the specific brain syndrome. This is the precise medical brain diagnosis or condition that is responsible for the chronic brain dysfunction in the first place. Now, the classification of specific brain syndromes falls into 2 major categories. There can either be genetic or acquired, and I'm going to give you some examples first of genetic specific brain syndromes that are associated with chronic brain dysfunction. These include Down syndrome, phenylketonuria, neurofibromatosis, Huntington's disease, Alzheimer's disease, and Parkinson's disease also have genetic components. There are many examples. There are probably thousands of different genetic syndromes that can occur. These tend to be mostly childhood onset, but adults, like for example, in Huntington's disease and Alzheimer's disease and Parkinson's disease, these are more adult onset. There are also, in childhood onset, a number of chromosomal deletions, which can occur, Fragile X syndrome, Williams syndrome, Angelman syndrome. But this will give you an idea of the many, many different pathological conditions that can lead to a chronic brain dysfunction. And it's important to be able to make the diagnosis of what that specific brain disorder is that's causing that brain dysfunction, because sometimes managing the specific brain syndrome can provide great benefit to the patient. The treatment of Parkinson's disease, for example, is very different from the treatment of phenylketonuria, but both can end up with chronic brain dysfunction. Then there are acquired specific brain syndromes. For example, perinatal hypoxic ischemic brain injury or injury of the newborn, measles encephalitis, lead encephalopathy, fetal alcohol syndrome, traumatic brain injury, cerebrovascular accidents or strokes, and then alcoholic encephalopathy, Wernicke's encephalopathy, Korsakoff psychosis are all examples of different acquired specific brain syndromes that are associated with brain dysfunction. The third essential concept refers to the complications or symptoms of the specific brain syndrome that result from the brain injury itself. In other words, what kinds of symptoms does a person have who has a brain disorder? Something that has injured the brain, damaged the brain, causing the brain to dysfunction. What kind of clinical symptoms does that person have? And there are 4 major categories of symptoms. We call these the complications of the brain injury. And they fall into these 4 categories: cognitive dysfunction, motor dysfunction, seizures, and abnormal behavior. So regardless of the cause of the brain injury, regardless of the cause of the specific brain syndrome, these 4 categories of symptoms are likely to occur. There's increased risk for seizures, whether you have Down syndrome or Alzheimer's disease. Abnormal impulsive behaviors are more likely to occur in someone with phenylketonuria or Parkinson's disease. So these are just nonspecific categories of symptoms that occur in anyone who has a brain problem. And if they don't have any of these symptoms, it's whatever the problem is, it's probably not a brain injury. Now, starting with the cognitive category. By that I mean difficulty with memory, judgment, speech, interpretation. There's a wide spectrum and variety of conditions of cognitive dysfunction. It may be mild, moderate, or severe. There can be mild dyslexia or learning disability, all the way to severe intellectual disability or dementia. And the labels are in part determined by the age of onset. If the cognitive dysfunction occurs in a very young person, it would be referred to as intellectual disability. If it's in an older person, it's more likely to be called dementia. Then there may be loss of motor control. Again, there are a wide spectrum and variety of motor dysfunctions. It can be associated with spasticity, lack of coordination, involuntary movements, and there may be autonomic motor problems as well. Focusing on the seizures, again, there's a spectrum. It can be something very mild or severe. It can be mild petit mal types all the way to severe intractable generalized tonic-clonic epilepsy or Lennox-Gastaut syndrome. And then behavior refers to loss of control of one's emotions and behavior. There can be mild impulsivity all the way to severe impulse control disorder associated with self-injurious behaviors, property destruction, or aggression towards others. So again, these four categories of symptoms of cognitive, motor, seizures, and behavior, there's a huge variety of the different specific symptoms that are associated with these categories. The fourth essential concept refers to the consequences of the complications, and the health consequences of the four complications of the specific brain syndrome. And this is getting a little bit complicated, so you have to know what a specific brain syndrome is and what complications the person has, and then you sort out the consequences of the complications. And let me get into that now. If you have cognitive dysfunction, what kind of problems are you likely to get? The person who has a severe cognitive dysfunction is more likely to have any kind of bodily injury. They may not be paying attention to crossing the streets or walking through a room. They may bump into something because they're not paying attention. They have a cognitive dysfunction, and they get a bodily injury. Poor oral health. They depend on caregivers for their oral health. They have difficulty understanding the importance of good oral health. There can be nutritional deficiencies and poor hygiene in general just from having a cognitive dysfunction. The health consequences of motor dysfunction include somatomotor versus autonomic problems. Examples of somatomotor problems is if a person is paralyzed, for example, or the physical activity is much reduced and a person doesn't get normal physical activity. There can be decubitus ulcers, constipation, scoliosis, restrictive lung disease leading to cor pulmonale, osteoporosis, injury from falls, poor physical conditioning, hyperlipidemia from lack of exercise, poor oral health. And then if there's autonomic motor dysfunction, there can be oropharyngeal dysfunction and aspiration. There can be gastroesophageal reflux disease, Barrett's esophagus leading to cancer of the esophagus. There can be constipation and fecal incontinence. There can be a neurogenic bladder or incontinence. So motor dysfunction has many consequences. There are many health consequences to motor dysfunction, and motor dysfunction is an important complication of a brain disorder. And just here's a schematic demonstrating how one thing leads to another, starting with motor dysfunction. You can see on the top it says immobility leading to osteoporosis and fracture, or below it says if there's scoliosis, can lead to gastroesophageal reflux, which can lead to Barrett's esophagus and cancer of the esophagus, or to aspiration pneumonia and chronic lung disease. But it all stems from the motor dysfunction, which is a complication of the brain disorder. Now, the health consequences of seizures include aspiration, bodily injury, drug toxicity from the anticonvulsant medications, and again, poor oral health, which can be drug side effects or damage from the seizures themselves. Now, the health consequences of behavior dysfunction include, again, drug toxicity from the drugs that are used to treat the behavior, bodily injury, and poor oral health, many times due to lack of cooperation of the patient. But there are a number of health consequences that result from the behavior problems that a person has. Now, you can imagine at this point that if a person has all four of the complications of a chronic brain disorder, they have cognitive, motor, seizures, and behavior, there are many, many health consequences that can result, from that. Now, the last or fifth essential concept is the syndrome-associated conditions, and these are the conditions associated with the syndrome itself, unrelated to the brain condition. For example, if you have Down syndrome, heart disease is more likely to occur in Down syndrome. Williams syndrome is known to be associated with high blood pressure. Tuberous sclerosis is associated with renal tumors. Angelman syndrome. There's some evidence that these people don't handle Tegretol very well, just because of something to do with the metabolism of the person with Angelman syndrome. So there are many examples. Once you determine what the specific diagnosis is, then you have to know what the specific syndromes or specific conditions associated with that syndrome are. So there's a lot to learn. Okay, that pretty much covers it. Hopefully you'll look at this presentation a couple of times and think about it and come up with your own examples of how, starting with a brain disorder, whether it's a childhood onset brain disorder or an adult onset brain disorder, the many health problems that result from that can be understood in a way that helps the physician or nurse approach the patient to try to organize one's thinking, and it helps you remember what you need to check for. So thanks again for listening, and stay tuned for more presentations which cover this issue of neurodisabilities medicine. Bye-bye.